afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset, and I am pleased to welcome you to today's webinar offered in collaboration with Friends Health Connection. Our topic today is the aches and pains of life, keeping your joints healthy. The information provided during the webinar reflects the opinions of the speaker only and does not reflect the opinions of Friends Health Connection or Robert Wood Johnson University Hospital, Somerset. The information is intended for your general knowledge only and is not a substitute for professional medical advice or treatment for specific medical conditions. You should not use this information to diagnose or treat a health problem or disease without consulting a qualified healthcare provider. Please consult your healthcare provider with any questions or concerns you may have regarding your condition. Today, we are joined by our special guest, Dr. David Abrutyn, a board-certified orthopedic surgeon who is the medical director for the joint surgery program at Robert Wood University Hospital, Somerset. Welcome, Dr. Abrutyn. Thank you for joining us.
Thank you.
We will begin our presentation with about 20 minutes of a moderated discussion, and then we will open up our forum to questions from our audience. So Dr. Abrutyn, let's start by giving an overview of how our joints work. Would you be able to share a little bit with us on that?
Sure. So basically the joints, particularly the hip and knee, the knee is a hinge joint that's made up with the femur or your thigh bone and then your tibia or shin bone, which is lined by cartilage. And then between the ends of the bone is meniscus or cartilage and ligaments that attach the bones to each other that give it stability. Normally, our joints don't hurt because the cartilage doesn't have any nerve fibers in it, but the bone or dirt does. So I normally liken this to patients as a newly paved road. So if you think of your joint like a road, the road being the cartilage, and then the bone is the dirt beneath the road.
Okay, very good. So how important is exercise in keeping our joints healthy? What types of exercise are best, and how long should we be exercising?
So exercise is very important for not only the overall health of our joints, but also of our bodies, minds, and souls. So it is important. Cartilage likes motion, but it generally doesn't like impact. So lower impact exercise such as walking, riding a bike, elliptical machine, swimming, yoga, Pilates is easier on your joints than running, jumping, squatting, lunges. Generally, exercise should be 3 to 4 times a week, ideally, and 30 minutes at a minimum. So the more, the better.
Oh, great. Thank you so much. So equally important, what role does nutrition play in joint health?
Nutrition is important in various ways. So for the athlete or weekend warrior, nutrition is important in terms of preventing cramping, preventing inflammation, and if you do get cramping or fatigue in the muscles because of poor nutrition, that can lead to dehydration and ultimately injury. Nutrition is also important in terms of your diet with respect to inflammation. So there's a lot that is now known about certain types of diets, or really the foods you eat in terms of processed foods and other foods that can help prevent inflammation, such as berries, nuts, orange vegetables, green leafy vegetables can help with inflammation. Fish that's high in oil, such as salmon, extra virgin olive oil, all of these things have been shown to help with inflammation. And then as it gets more relevant to patients is in terms of surgery, nutrition is important because if you're diabetic, it's important that something called your hemoglobin A1C, which is a marker of how well your sugars are maintained, becomes important, as well as other markers of nutrition. And this is all very important in terms of healing, preventing complications from surgery such as infection and wound healing.
Oh, thank you. That was a great overview. So why is it important to then maintain a healthy weight? Because this is all tied in, exercise, nutrition, to our weight.
So weight is, a big challenge as a joint replacement surgeon. So obviously, if you're in pain, it's hard to exercise, and if you can't exercise, it becomes more challenging to maintain or lose weight. But when you walk, you put 3 to 5 times your body weight through your hip and knee. So clearly the heavier you are, the more force that is on your joints. So if you're having pain, losing weight doesn't cure arthritis, but it will help decrease your pain.
Okay, good to know. So when we think joints, a lot of us always automatically think about athletes. So what can athletes do to protect, their joints?
So the best prevention is focusing on core strengthening of your hip, your gluteus, butt muscles, your abdominal muscles, hamstrings, quadriceps strengthening. Particularly something called eccentric strengthening is very important. So when you fire your muscles, you can contract them what's called concentrically. So when you make a biceps muscle, the muscle's getting smaller, but you also can lengthen the muscle and it's still firing. And most of us are weaker in what we call eccentric contraction. So athletes are best served by focusing on eccentric strengthening and core strengthening, because this could help not only their performance and improve their performance, but also help prevent injuries.
Okay, very good. So can you explain for our audience what arthritis is and how that impacts our joints?
So arthritis at its root means arthro is joint and itis is inflammation. But basically what arthritis is, it's the breakdown of the cartilage that surrounds the joint. So again, getting back to the original explanation of a joint, is if you think of it like a newly paved road, you can get softening of the road, cracks in the road, progression of those cracks, and then particles of the road. Eventually you have potholes or exposed bone or dirt. So as you start getting wear in the road, the bone or dirt has nerve fibers in it, and that can cause pain. So at a minimum, generally arthritis manifests itself as pain. But also as you start wearing out the road or cartilage, if you can get inflammation, and then your body tries to help combat that by creating inflammation which causes swelling, so that can cause pain. And then if you have loose pieces of the road in your knee or your hip, that can cause mechanical symptoms such as locking, catching, buckling, and then ultimately also cause pain.
So what treatment options are then available for joint pain?
So there's various treatment options, from non-surgical to surgical options. Obviously, we always like to exhaust the non-surgical options for everybody. Physical therapy can be very beneficial in terms of helping with soft tissue modalities to help with pain, swelling, your range of motion, and by doing light strengthening, that can also help prevent injury and pain in the future. Weight loss, again, as you mentioned, can be helpful, but easy to say, hard to do. Anti-inflammatories, such as like Aleve, Advil, Motrin, or prescription anti-inflammatories can help, but those aren't good long-term treatment options because of side effects. There are various types of injections, from cortisone or steroid injections to lubricating type shots called hyaluronic acid injections. And there is a lot of research and big movement towards what's called orthobiologics, which includes stem cells and platelet-rich plasma, which is still in its infancy in terms of generalizability, but in labs it's very exciting. Bracing can also be a treatment option depending on where your arthritis is in the knee. And then ultimately the definitive treatment is surgical options. And this includes sometimes arthroscopic surgery to clean up your knee, so to speak. There's something called an osteotomy, where we could change the alignment of the knee, and then partial knee replacements or total knee replacements or total hip replacements.
Well, thank you. So when should somebody consider joint surgery?
So ultimately, the driving force for treatment is pain. So when your pain is significantly affecting your quality of life and activities of daily living after you failed all other treatment options, then you would be a candidate for joint replacement. Obviously, there's always other considerations, but I would say that the driving force is pain. With respect to the knee or hip, as you lose range of motion, that can further affect your outcome. So the best predictor of your range of motion after surgery is what was your range of motion before surgery. So someone who's losing motion in their knee joint, for example, that would be another consideration. And then obviously your age, other medical problems become factors as well in terms of when to consider the timing of surgery.
Okay, thank you. So what can somebody expect when they undergo a joint surgery? Like, how long is that recovery process? You know, can you take us through that?
Sure. So at our institution, we do surgery. It's a patient-centric model where everything is focused around the patient, and generally our patients stay overnight. Usually most patients stay over a minimum of 1 night, some patients 2 nights. For some of our hip patients that are having an anterior approach, they can go home even the same day. But generally it's at least a 1 to 2 night stay in the hospital. We have group physical therapy at our institution where patients get directed physical therapy twice a day, and we also empower their family or friends to coach them and do physical therapy throughout the day. 80% of our patients go home, and we have a therapist or nurse typically come to the house for the first week, and then you end up going to outpatient therapy. We also, obviously, everyone's focus is on pain, and we do a multimodal approach to pain. So both leading up to the surgery, the day before surgery, the day of surgery. We do peripheral nerve blocks to try and minimize your pain during your hospitalization, because again, as we can minimize your pain, you'll do better and return to function better. Generally, it's about 4 to 6 weeks till you're independent and without any assisted devices, walking and driving.
Oh, well, thank you. So at this point, I'd actually like to open it up to some questions from our audience. So if you are online, you can actually log on to the question box, type it in, and then that will pop up on our screen, and we'll be able to take your questions. So again, question from our audience is, what can they do to combat pain? So I know you mentioned a few, but could you maybe elaborate on some of those options?
So yeah, it depends on what's the source of pain. If it's just if it's from arthritis, stretching can be very important. There's something called depending on, again, I'm assuming the knee or the hip, but foam rolling is a great tool, and that you can buy, in a sports store or on Amazon. There's also a tool called the stick, which is literally a stick that you can do what we call myofascial release, where you're stretching your quadriceps, hamstrings. I mean, again, anti-inflammatories can help depending on what the cause of the pain is. Physical therapy as well, but there's no one take this and your pain will magically go away, unfortunately.
Okay, so I guess another question came in is there anything that can be done to avoid surgery?
Well, once you have arthritis, again, whether you live an active life or sit at home and sip tea and never exercise again, the arthritis can progress. And right now, there is nothing in our toolbox that will prevent the progression of arthritis. So ultimately, depending on your lifestyle and what you like to do for activity, modifying your activity to try and do lower impact exercise to minimize your pain, and to try these other things, physical therapy, injections, bracing, those can help. And ultimately, it's pain. So everyone's pain threshold is different. So I have patients that have severe arthritis by x-ray, but don't have significant pain, and those people never need surgery.
Okay. Well, another question came in. You talked a little bit about joint surgery replacement, and I guess there's a little bit an interest in learning a little bit more about the surgery, and I guess other surgeries in general. So I guess when you have a specific, maybe you can explain, when you have a specific joint replacement, what is actually done? Because right, a knee is different from a hip, is different from a shoulder.
Sure. So generally, like for the knee, you end up with an incision in the center of your knee, Depending on the surgeon, myself specifically, I do what's called a quadricep sparing approach to the knee, so I don't go through the tendon, which is less invasive, and the front end minimizes your pain and gets you up ambulating, I think, faster. And in terms of knee replacement surgery, most people think we're cutting your knee out. We're not truly doing that. We're cutting a few millimeters of bone off the end of the femur, your thigh bone, as well as off the tibia or your shin bone. We remove your meniscus and your ACL and PCL, which are the ligaments of your knee. And then we're putting a metal cap on the end of the femur and the top of the tibia and plastic in between. And in terms of hip replacement surgery, patients can either have an anterior approach or a posterior approach. Either way, you're cutting out the ball of the hip joint and putting in a new socket with plastic and a metal stem inside the bone with a metal ball on top. I personally do shoulder and knee replacements. I don't do hip replacements, but generally anterior and posterior approach have excellent outcomes. The advantage of an anterior approach is it's a little less painful, and the recovery is a little bit shorter on the front end, but the results at 6 months are equal. Shoulder replacement surgery, similarly, like the hip, we're cutting out the ball of the humeral head and putting in a metal stem and a metal ball and plastic on the glenoid of the socket.
Okay, so how long does the surgery take? Like, how many hours are you actually, in the OR? And then what is the recuperation period like for each of those?
So again, that's surgeon specific, but generally in my hands, it takes about 45 minutes for a total knee replacement. A shoulder replacement is about an hour and a half. And hips, usually, again, most people, is about 45 minutes to an hour and a half, depending on the complexity. In terms of the recuperation, you mean in the recovery room, or?
I guess how long it's going to take somebody to recover from that surgery.
Right. So depending on which joint it is, for a total knee replacement and hip replacement, we get you up and moving right away. A lot of patients who have a dull, aching, constant pain, that pain goes away almost immediately. And then you have surgical pain, so there is pain after the operation, but it's a different kind of pain. Sleeping is usually the biggest challenge, particularly for the shoulder and knee. So that usually takes about 4 to 6 weeks till patients are sleeping comfortably. But again, for knee replacement, hip replacement, usually within a few weeks, people are walking with a cane and then eventually nothing. Shoulder replacement is a little different. So again, the pain goes away pretty quickly, but most of the time we have to protect you in a sling for the first 6 weeks. So we let you cut your food, feed yourself, but we don't let you push up from a chair, lift anything heavier than a fork, because in order to get into your shoulder, we have to go through one of your rotator cuff muscle tendons, and we repair that when we're done, and so we have to protect that repair initially.
Okay. So another question from our audience is, are there any limitations after surgery? And again, I would apply it to all those three that you just described.
So generally, no, because most of the people we're doing are, in their 60s, 70s. So we're not doing this so you could run a marathon per se. But generally, you can get back to biking, hiking, playing tennis, gentle skiing, golf, swimming. People, we let them kneel on a knee replacement surgery, but some people have difficulty kneeling on their knee, not because they can't do it, it's just uncomfortable. But most people get back to a high quality of life and playing with their grandkids and doing activities that they haven't been able to do for years.
Okay, so one of the things one of our audience members wanted to know, are you able to, after that recuperation time, resume to normal activities, or are there, some activities you still might not be able to do?
Generally, the expectation is that we get you back to all of your normal activities of daily living, including exercise and gentle recreational sport activity. So you're not necessarily playing basketball, but you could shoot baskets, if that makes sense.
Okay. So does age affect that recovery time, the recuperation time?
No, because age is really a number. So, I have patients in my practice who are 60 that, look older than some 80-year-olds in my practice. So it really depends on the individual, what their function is going into the surgery, other medical problems, and the like. So generally, age is not the issue. Sometimes age can be an issue with respect to bone quality, but that's more of an intraoperative consideration, but doesn't affect the outcome.
Okay. So another question from our audience member was, how long do these joint replacements last? And is there a possibility that somebody's going to need another surgery down the line?
That's a great question, and we get asked that all the time. So when you ask that question, it's a statistical question. So if we do 100 knee replacements today, in 20 years, 85 of them are still in place. So most of them do last a long time, but there are a percentage of people that will need revisions. So that's certainly a consideration for the younger population, the 45 to 60-year-old, because if they have a knee replacement at 50, they may need another one in their lifetime. Now, getting a revision hip or knee or shoulder doesn't mean you have to redo the whole thing. Sometimes it could just be one part. So it really depends on what part wears out. But again, at the end of the day, if you're having severe pain, you failed everything else, 85% at 20 years is a pretty good option.
Okay. So is there ever an upper limit where you won't do like a hip or a knee or shoulder replacement on somebody? Like somebody's maybe in their 80s, mid to late 80s, and you say, you know what, at this point, it might not be a viable option for you?
So yes, there are certain indications why we wouldn't do surgery. Generally, it's not because of age. So again, if it's more looking at the patient as a whole. So depending on your medical problems, certainly before every joint replacement surgery, you have to get clearance from your medical doctor and or cardiologist, pulmonologist, depending on your medical problems. So if you're at high risk for anesthesia complications, that's a consideration. Again, we try and optimize patients to prevent orthopedic complications like infection, wound problems. So for diabetics, if your hemoglobin A1C is above 7, that would be an indication not to never do the surgery, but we would need to get you below 7. If your hemoglobin or blood level is low, we need to optimize that to prevent blood transfusion. There is something called albumin, which is an overall marker of nutrition, and if that's low, that can be a contraindication for surgery. And then the other things are your weight. So people look at what's called your BMI, and if that's over 33, that some surgeons won't do surgery because of the higher risk of complications. And then we always look at your joint quality and other factors. So if we don't think that your bone can accept a joint replacement, that would be a consideration, but that's uncommon.
So to expand upon that last comment, what would make a bone not acceptable for a joint replacement?
So if there's significant deformity, that can be a challenge to reconstruct it. If there's significant the ligaments are incompetent. Some patients have severe, they have no motion in their joints, and so that can be a challenge depending on exposure. But usually that's a rare reason to not do a surgery, or if there's an active infection, less common causes. But it's generally the other things that I discussed that would preclude surgery.
Okay. How about somebody who might have osteoporosis? Would they be a candidate for a joint replacement surgery?
Yes, because obviously most of the patients we are doing, particularly the female patients, probably have osteopenia or osteoporosis. So depending on, again, patient's body size, habitus, sometimes we put stems in a knee replacement to protect the bone. We use cement when needed. So there are other ways of treating the patient with osteoporosis, but generally that's not a reason not to have surgery.
Okay, and just in case, can you explain what osteoporosis is for our audience and how that does impact joints?
Well, so osteoporosis is when the bone density decreases over time. So we hit our peak of bone density usually in our mid-30s, and for men it's greater than women, and it slowly declines with age and time and changes in our hormones. And so there's different measures, but generally it's measured by a bone a DEXA test, which is usually done by your medical doctor, endocrinologist, sometimes your gynecologist. And that's just a marker for a risk factor for fractures generally. So it usually doesn't correlate with arthritis. So generally osteoporosis and arthritis aren't related, but it's a consideration in terms of what your bone quality is for surgery.
Okay. Does that have any significance on somebody, getting or having joint problems down the road? Osteoporosis?
Well, it can affect your bones. So obviously it can cause joint problems in the sense you're at higher risk for fracture. You can get higher risk for fractures in your spine. There's, recently it's been noted that people on the bisphosphonates for long periods of time are at higher risk for fractures as well. So yes, it doesn't necessarily affect joints per se, but it affects your bones.
Okay, very good. So another question from our audience is, will stretching help with joint health? So, or is it more of the weight-bearing type exercises?
No, so stretching is very important because, as we age, we get stiffer and tighter. And as, the stiffer you are, that can cause you to walk abnormally, which can put more force around your hip or knee. So certainly stretching is very important and helpful for your joints. Okay,
very good. I don't see any more questions. We have one more minute. If anybody has any additional questions, now would be your time to ask. I know we've fielded a lot of questions, so I have to thank our audience. They were great questions. Okay, so a question from our audience is, will this actually be posted? So yes, in a few weeks, we will actually have this webinar edited, and then it will be posted on our actual website, which I will speak to in a few minutes. Great questions. Is there anything else, Dr. Abrutyn, before we depart for today? Do you have any suggestions or final tips you wish to share with our audience?
Basically, I think that obviously arthritis is something that affects many people. Over 30% of people over the age of 18 have joint pains. So not just arthritis, but aches and pains. So certainly staying active, staying healthy, eating well is all very important, but you shouldn't be afraid to reach out to your doctor or find an orthopedist to further discuss your treatment options.
Well, great. Well, thank you so very much. Well, this actually will conclude today's webinar, and I want to thank you, Dr. Abrutyn, for joining us today. You've been very informative. Again, please remember that the opinions shared here today by our medical expert are not a substitute for medical advice from a physician. If you do need a physician, please call 1-888-MD-RWJUH. For more information about joint replacement surgery, please visit our website at www.rwjbh.org/Somerset. Thank you all again, and have a great day.
Thank you.